Ayushman Bharat Digital Mission laga nichide state Model District Dimapur aji launch kudishe zone near to by the park town hall Chumoukedima de Educare National Health Authority laga CEO Dr. Sunil Kumar Barnwal pra launch kudishe. Inaugural workshop homoy Dr. Sunil pra kushe ke to pra opportunity khan kolabole akase Nagaland 9 lakh manu ABHA card ase kushe kuntu population laga 38% ase. Juchikunuba manu HMIS system chulai ase koile ABDM logude milai dile bal hobo kushe. IB report ekta sam.
We are honored that Dimapur district has been selected as the ABDM model district for Nagaland, and the district hospital Dimapur has been identified as a model public facilities. This recognition is both an honor and an opportunity. It allows us to demonstrate how digital health solutions can transform healthcare delivery at every level, from something as simple as patient registration and health record management to ensure better continuity of care. The successful implementation of ABDM has the potential to make a meaningful difference in the way healthcare services are delivered to our people. The success of this initiative rests on the commitment, collaboration of everyone gathered here today. The government alone cannot achieve this transformation. It requires the dedication of healthcare providers, the administrators, the technical partners who interact with the citizens every day.
These recognitions reflect the collective efforts of health and family welfare departments, healthcare workers, and all stakeholders who have worked tirelessly to modernize healthcare delivery. I, on my own behalf and on behalf of the people of Dimapur district, would like to convey our thanks and appreciations to National Health Authority led by Dr. Sunil Kumar Banwal, IAS CEO, and also Dr. Pankaj Kumar Arora, Director, NHA, and also the team and staff of the NHA.
See, when every time you get a symptom, it becomes a history for next level of treatment. So if a doctor knows in last few years what kind of treatment you have got, they will have a right diagnosis for your treatment. If they don't have, they will still treat you, but that will be little more, predictive, or they may be analyzing based on limited information. And that is why they keep asking you, tell me if you get this kind of symptom in the past, what did you take, what medicine did you take? These things they ask and you reply based on your memory. So now, this is completely fragmented episodic healthcare delivery in India. This continued for many, many years in India, and we are actually not just getting fragmented healthcare. Sometimes we are victim of this fragmented healthcare because we are not taking advantage of the comprehensive treatment or a right diagnosis. Now, this could not have changed if the technology would not have supported. Now with ABDM and the larger digital health ecosystem which we want to create, there is an opportunity. With the same fragmented healthcare systems, where every hospital use different systems, every pharmacy have a different system, and still with the digital technology we can make them talk to each other. We can connect all separate health systems to make sure they can talk to each other, they can share records with the consent of patient, and in whole process, the patient get empowered. And that is what is happening with the ABDM, we have created health IDs for about 92 crore citizens of this country. And even in Nagaland, about 9 lakhs, 8.96 lakhs people of Nagaland has got Abha ID, which is about 38% of the population, which we need to make it 100%. Because every person should get a health ID. It is based on Aadhaar or some document, but since Aadhaar we can't use very easily at every time, we can't share Aadhaar, it has biometric details. We decided to have a separate health ID, and this health ID actually deals only with your health and wellness. So this is one registry which we made, in which every citizen's ID is created. Once there is an ID, you are uniquely identified, not just by name. Name can be, multiple people can have same name, but ID will ensure that you are uniquely identified. Similarly, for every health facilities, whether it is a hospital, pharmacy, or diagnostic centers, or even blood banks, whoever provides health care, they need to be uniquely identified and mapped. And this is what has been done by the Health Facility Registry. Today, we have about 2.63 or maybe about 3 lakhs facilities which have been registered in the country. Even in Nagaland, you have almost 1,352 facilities registered. Maybe you may be having more facilities, but everyone should be registered. Advantage of being registered on a national registry is twofold. One, your identity is verified, uniquely established. So if you are on HFR, you have an identity, people can be sure that it actually exists. It is a verified health facility. It is not a fake facility. It has been verified by the competent authority of the state government or the National Medical Council, or whichever is the authority to do that. So one is it establishes your verified identity. Second, by being on the registry, you are discoverable at the national level. People clearly know that where do you exist. If they search on Google or on any internet search, they will be able to find a hospital or a pharmacy in Dimapur or any part of this country. So two big advantage comes to the health facility if they are on the registry. And this unique identity to the every facility also helps in creating a digital health ecosystem. And third important registry is the health professional registry. I know the doctors are registered with National Medical Council, nurses are registered by National Nursing Council, pharmacists is registered by Pharmacy Council, and similarly many other professionals are registered with their respective council. But this data remains with the council. Where do we know exactly those who are delivering health care, whether it is a doctor, nurse, or pharmacist? They can be at one place with a verified identity. We are gathered here for one-day workshop on model district and model facilities for the digital health ecosystem. As you may be aware, National Health Authority is bestowed with this responsibility of implementing Ayushman Bharat digital mission across the country to create digital health ecosystem in this country. The digital health ecosystem actually aims to migrate the fragmented healthcare to a more connected and integrated healthcare, and finally to intelligent healthcare. And in that direction, we are making one model districts in every state. In the state of Nagaland, Dimapur has been selected to be made model district, in which all the health facilities, including hospitals, pharmacies, diagnostic centers, will be made completely end-to-end digital to provide digital health record linked with the Aadhaar ID of the patient, so that the patient can have access to the health record on their mobile. Also, the records can be shared across the facilities with the express consent of the patient. This empowers the patient, keeping patient in the center. The digital health ecosystem actually develops and generates huge digital health records, which will be the foundation for application of future and not so future. It is already there. The technologies like AI and other emerging technologies. So in the state of Nagaland, Dimapur district has been made the model districts, and similarly in all other districts, one public hospital and one private hospital has been made and going to be on complete digital health. So with this, we want to create model in each state so that the other facilities also will take the clue and make themselves digital. The advantage of digital health, as I said, patient will get the complete health record on the mobile. Hospitals have the health record in a digital forms, and finally, the health record travels with the patient. So next treatment or next episode of healthcare, the patient's whole past history can be seen by the doctor with the consent of patient, and then right diagnosis and treatment can be provided. So this is one big advantage of digital health. Ultimately, the aim is also to make all the hospitals which are impaneled under Ayushman Bharat PMJ scheme and CMHS scheme should be on complete end-to-end digital. Right now, they they scan the document and upload for the claim settlements and even for the pre-authorization. So once they use ABDM-enabled HMIS and are also integrated with the National Health Claim Exchange, they will be able to submit the claims directly from their HMIS. That will also ensure more reliability and genuinity of the claims, and therefore they can be prioritized in making the payments to those claims. So going more digital brings more transparency, it brings more objectivity, and it also generates data that can be analyzed, and in long run, in future, these digital data will also help us in early detection of the disease, making population health decisions by which disease surveillance can be done by different geography, different demography. Like if we have a good data and we have good analytics, then we can say that in which part of Nagaland, which kind of disease is prevalent. In which period of the year, which kind of disease becomes more prevalent, so that preventive steps can be taken beforehand. Right now it is happening based on the perception, based on the experience of the past. It is not data driven. It is not evidence based, which with more and more facilities coming on digital health, more and more data getting generated in a digital form, these all will become a possibility. And this is already becoming a possibility in some of the states, and I wish Nagaland takes the lead and becomes one of the front runner in creating digital health ecosystem in the state.
I have a question. You've spoken on digitization of medical reports. So, can you give the assurances that the medical records would not be leaked given the circumstances that many...
I must clarify this. The Ayushman Bharat digital health architecture, the way it is created, the health records doesn't move to any central repository. Right now, Government of India or NHA have not made any central repository or database. So all the health record which is generated remains at the source, whether it is hospital, pharmacy or diagnostic center. The only thing is now it gets linked to the patient Abha ID. So the record is with the hospital and also linked with the patient. So only the patient and the respective hospital have the record. Now when the patient gives the consent to share a record from one hospital to another hospital, the sharing is peer-to-peer. Because since we don't maintain any central repository or database, there is no risk of security or of privacy. So the architecture is both privacy and security is met by design itself. That is why this system is highly scalable, and I must tell you this is one of the unique kind of system which country has built, and not many countries including developed countries have such system. So this kind of system where you are ensuring privacy, you are ensuring security in the design itself makes sure and gives confidence and trust to the people that the data is either the hospital or the facility where they got the treatment or with the patient whom treatment was done.